Women are waiting at least 3 months to get a screening mammogram from the time it was ordered by their physician to when it can be actually scheduled. It is a very long time. That's a dangerous thing. I'm Dr. Cory Donovan, and I'm a surgical oncologist specializing in breast at Legacy. The initial fundamental screening tool we've developed in breast cancer is the mammogram, where we take 2 pictures of the breast, one squishing from top to bottom and one squishing from side to side. The goal of screening mammography is to find things that are less than a centimeter in size, which is less than a pea or garbanzo bean. Those are things you cannot feel for the most part. It takes something to become about 2 centimeters or an almond or a olive sized for you to be able to feel it. So the goal of mammography is to find something before you can even feel it, before it's even a problem. So when I was 34 years old, I felt a mass in my breast. I was in the middle of my surgery residency. That's right, my breast cancer fellowship. And I ended up having a pretty aggressive triple-negative breast cancer. I underwent 6 months of chemotherapy, followed by a bilateral mastectomy. The ways that chemotherapy changes your life are so hard to articulate, but are pretty profound. We were very worried about how to preserve the feeling in my fingers so that I could still be a surgeon when we were all said and done. But after I was diagnosed, my mother then was undergoing high-risk screening, and they found her breast cancer. Her breast cancer was found when it was 1 centimeter in size. So I can tell you unequivocally that screening is incredibly valuable. It saved her life. So the reason that we desperately need another mammogram machine is that Clark County has grown exponentially in the last 5 and 10 years. Unfortunately, mammography capacity has not gone in that direction. The Doug and Heather Green Breast Health Center here is a beautiful, calming, restorative space. But we need to shift and shape that space to better accommodate the volume that we have. People want to be proactive about their health. Let's help them do that. Survival rates for breast cancer are amazing, especially early breast cancers that are caught on screening. Survival is 95% and above at 5 and 10 years down the line. This is going to be my 10th anniversary of being diagnosed with breast cancer this September. I've got a 4-year-old and a 7-year-old. I love being a mom. And that's in part why I feel so passionately about trying to decrease the amount of trauma our patients go through, because I know the vast majority of them are going to go on to live these rich, amazing lives, and I want them to have everything they always wanted. Most of the cancers we find on screening mammogram are very small. And so if we can catch these cancers early before they change people's bodies or, change the choices and the options they have going forward, I mean, how priceless is that?